THC and CBD get all the love, but CBG is actually my favorite.
Today we're talking about CBG. CB good, CB great. That's just what I call it. Tell us about what's the difference, Blake, between CBD and CBG?
Okay, I'm going to try not to get too nerdy, but here's the way this works: is typically all cannabis plants have different enzymatic pathways, and so you're going to take a acid form, and you're going to pair it with a phosphate group, and you're going to put these things together. Your first molecule that your cannabis plant makes is CBG. And CBG, as we call it, is a precursor molecule. And then from CBG, you make THCA, CBDA, CBCA, and then from those, you make all these other different cannabinoids. CBG is awesome because it's one of the few that we have some actual clinical trials on. And so there's a study that's out of the University of Boston that shows that it arrests metastasis of glioblastoma. We have seen that it has anti-inflammatory effects, and its cellular absorption is much higher than that of both CBD and even THC.
Wow. So are there products that you're developing or that you produce at Zion that have CBG in them?
So Zion specifically uses different cannabinoid therapies for specific conditions. And so there are lots of different types of products, from tinctures to topicals and even vape carts that you can buy in the market that have CBG in them.
Kylee, because CBG is your favorite, like, is it something you're talking to patients about?
Every single time I talk to a patient, I feel like there are so many conditions that could benefit from CBG that I'm talking about it with every single patient.
Why CBG specifically?
It's excellent for inflammation. It deals with pain. It deals with mood, which is everything that patients come in for. That encapsulates everything that they come in for.
But it doesn't get you high?
It is not psychoactive. And so when we say it like that, what we're saying is it does not give you that effect where you're feeling high.
So it doesn't cause the time dilation,
no,
but it's still treating condition. Whoa, is this kind of talking about medicine? Uh-oh.
I know. It's a little crazy.
This is crazy. Okay, so CBG, you can, in the lab, you can take CBG because it's a precursor, and you can kind of manipulate it into other cannabinoids?
You can. That's probably 4 or 5 videos worth of information of how you actually take cannabinoids and change them into others. But this is the easiest way. Like, let's just be really clear about this. There are high CBG strains of flower that exist where you've knocked out the other enzymatic pathways, the same way medical cannabis has knocked out the CBD and CBC pathway. And so they produce almost exclusively THC. And then hemp industry has been trying to eliminate the THC pathway
and just do the CBD.
And just do the CBD and CBC. There are geneticists out there that are trying to eliminate all 3 pathways and just have really high levels of CBG. And that is, so the easiest way to get CBG is to extract it from a high CBG plant and then isolate it.
What types of patients will benefit from a mix? So like here we have a product that is half CBG and half THC in the Utah market, a vape cartridge.
PTSD patients that come in with pain. Pain is often associated with anxiety. You'll get anxiety because you have pain. I use it a lot in those patients that are already on antidepressants where I'm treating another condition. They will always benefit from having some CBG in there. And it can be in any form that they want. If there's some CBG in there, they'll find benefit.
So here we have a few products. We've got tincture with, like, this is 1:1:1. So 1 milligram of THC, 1 milligram of CBD, 1 milligram of CBG. These are somewhat new products in the market, right? Because we've been focused so much on THC and CBD.
Mm-hmm.
So pain, this is going to be a little uplifting, maybe mood,
mm-hmm.
but not quite as heady or as stony effect.
No. I find a lot of my patients are able to function throughout the day when they use any of these products, as long as they're finding their right dose. they function just fine. They can go to work, or they can do work around the house. They can take care of their kids. They're finding a lot of benefit that way.
And typically, so I've seen two interesting trends. So first off, one, we have a lot of people who are buying CBG flower, and they're actually mixing it with their THC flower. And so I think that's an interesting, because they're noticing the effect of increasing the CBG count. And the second thing is, when we talk about entourage effect, when you think that, oh, I normally take 10 milligrams of THC and 20 milligrams of CBD, so I need 20 milligrams of CBG, that is not the case when you pair it with other cannabinoids. Typically speaking, for every 25 milligrams of CBD, you only need about 5 milligrams of CBG. So it's about a 1-to-5 ratio. And then the same is basically applicable for THC. For every 25 milligrams of CBD, typically you only need about 5 milligrams of THC. And so those ratios seem to be much, much closer together.
They're really cool products. And I like the fact that we're giving people more options from a medical standpoint. You know, if you're a patient with a lot of chronic pain and you're new to cannabis especially, a lot of people are looking for ways not to get so high, but to still get some relief and do the things that they want to do during the day. And I think CBG, from what we're talking about, is a good option because it's not going to give us that so much of that head high, and they can still use a little more. If their pain is really severe, you can use a little more of it without risking getting that too high feeling. Yeah, getting nauseous or having those
and needing to lay down.
And let's talk about the side effect really quickly. If you take an awful lot of CBG, lethargy. We haven't seen any toxic events from it whatsoever. There's no data to suggest that there's any kind of an overdose that is harmful to the body per se. If you have a lot, you'll feel lethargic.
So what's the difference between like a high THC CBD product versus a THC CBG product if I'm taking those high doses? Does CBG have that, like, what's the patient going to feel?
A little less high in the head.
Back to your lack of symptoms, right?
Yeah, you should notice that you probably just start feeling better. You have a better peace of mind. You have less pain. You just feel better. Yeah, you feel good. And it's not because I'm now stimulated, I'm having this time dilation effect and I'm ultra creative, right? That's not what we're talking about. We're talking about, I just feel better.
Right. So when it comes to CBG products, you can find some CBG products that don't have any THC in them. You can find CBG flower in the hemp market. When it comes to the medical THC market and the medical marijuana market, these products are usually going to be blended with THC, like the vape cart that we showed you that has half THC and half CBG, the Heal You tincture that has 1 milligram THC, 1 milligram CBD, and 1 milligram CBG. You can try these products for different conditions. Make sure, again, that you're talking to the pharmacist at the dispensary and the pharmacy about what products might be beneficial for you. Kylee really likes CBG. Come visit her at WholesomeCo and have those discussions about your condition. And I think this is a really great new way to consume cannabis in a real medical way.